Well, good afternoon, and it has been a while since we have gathered like this, and I hope everyone has been doing well. Thanks to the reporters in the room and on the phone for being here, and also thanks to everyone who is watching from home or wherever you are this afternoon. Today, I want to update Virginians on the Delta variant and the ways that we are responding as a Commonwealth, especially a few next steps that we are taking to expand vaccinations. I just want you to know that we have worked throughout this pandemic to keep people safe. As I think most of you know, I'm also a doctor, along with some other folks standing up here with me. Over my years as practicing, I have had the opportunity to have to intubate individuals and put them on breathing machines. That requires placing what we call an endotracheal tube down through the mouth between the vocal cords into the trachea. It's a little bit smaller than a garden hose. Requires putting people on a ventilator. I have watched individuals fight for every breath, and I have also watched individuals take their last breath. And so I want you to know that as your governor, I will do everything that I can to keep you from that scenario. Just earlier this week, we had a webinar with Dr. Anthony Fauci to talk with healthcare providers about getting the vaccine into more arms. Our efforts have paid off. When we last spoke in early May, things were looking very good, and they still are overall. This summer, our case counts have dropped to the lowest we have seen since October of 2020. And we have been seeing drops in hospitalizations, deaths, and in our percent positivity. We've had overall a very good summer. At one point, we had fewer than 100 cases a day. We reached President Biden's goal of getting 70% of adults with at least their first shot, and we did it 2 weeks early in mid-June. The end of this virus, it seemed to be within reach. And the vaccines are still working. I want Virginians to understand that because vaccines are key to everything we're going to talk about today. But unfortunately, we are now on a different trajectory. The arrival of the Delta variant, combined with the number of people who are not vaccinated, is driving our case counts back up. A large majority of people getting infected now are unvaccinated. They haven't gotten their shot. That's happening all across the country. Fortunately, Virginia is doing better than most other states. So let's look at the data here in Virginia. First, this slide shows you that our case counts have been going back up over the past couple of weeks. Fortunately, when you step back, you can see that we are nowhere near the number of cases that we saw last winter. And I am confident we will not go back to that point. But cases are rising again, and so are hospitalizations. This is playing out across the country, and it is because the Delta variant is significantly more contagious than previous strains. We all need to understand that Delta is different than the COVID strain that we were dealing with earlier this year. It's much more contagious, and it comes with a higher viral load that can make people sicker and faster. The only way we can beat this virus is vaccination. And it breaks my heart as your governor and as a doctor to see people getting sick, getting hospitalized, and unfortunately dying of a disease that is now preventable for most people, a disease they could get vaccinated against. Almost 73% of Virginia adults have had at least one dose, and 54% are fully vaccinated. That puts us ahead of many other states, especially in the South. But we want more people fully vaccinated because, again, vaccines work. Let's look at who is getting sick from COVID. Our data show that since January, 99% of COVID cases have been in people who were not fully vaccinated. 98% of hospitalizations and deaths have been people who were not vaccinated. You can see that very clearly on this slide. The gray line is all the new cases we've seen since June the 1st. It's actually very hard to see because it's covered up by the blue line, which is the cases among unvaccinated people. The yellow line, which is way down at the bottom, is the cases among people who were fully vaccinated people. So vaccination works. It is that simple. Even though Delta is more contagious, vaccinated people are still strongly protected against getting so sick that they have to go into the hospital. Nearly every single person who has died from COVID has been unvaccinated. As I said, vaccines are the only way to stop this virus and get back to the normal lives many of us were rediscovering just a few weeks ago. And that's why new actions that I take as governor will be focused on promoting vaccinations. So today, I'm taking an important step to protect state employees. We have around 120,000 people who are employed by the state of Virginia. And speaking as the head of that workforce, I want everyone to be as safe and protected as possible. Today, I am announcing that we will require all state employees to be vaccinated and show proof of that vaccination by September 1. Anyone who chooses not to be vaccinated will have to get a COVID test every week and show proof of a negative result. I am directing this measure to keep state employees safe and to keep the people that we serve safe. And I really encourage local governments and private companies to do the same thing. There is no reason why we need to see more suffering and sickness. Not when safe, effective, free vaccines are readily available at your local pharmacy, at the grocery store, at your doctor's office, at the health department, at lots of places in every community. To find out where to get vaccinated, go to vaccinate.virginia.gov. Again, that's vaccinate.virginia.gov, or call 877-VAX in Virginia. And the number for that is 8677-829-4682. Now, I want to talk to the people who may have hesitated. Maybe you're worried about side effects. Maybe you wanted to wait and see how other people reacted to the vaccine. But I hope you will listen to me and hear me now. The time for waiting is over. Millions of people around the world have been vaccinated, and we are fine. 350 million doses have been distributed in the United States, including nearly 10 million right here in Virginia. So please, protect yourselves and the people around you. Get vaccinated. We have all seen the news stories and Facebook posts from people who are very sick with COVID, who wish they had gotten vaccinated. For example, in the news today is Bristol resident Travis Campbell, who has been posting videos to his Facebook page. On July the 25th, Travis wrote this, and I quote Travis, "I truly regret not getting the vaccine. I'm testifying to all my bulletproof friends that's holding out. It's time to protect your family. It's not worth getting long-term lung damage or death. Please go get the vaccine." End of quote. Travis also said in a video that he's over the stupid conspiracies and urged people to be rational and protective, not stubborn like he was. Travis, I am grateful to you for using your situation to encourage other people to get vaccinated. And I sincerely hope that they listen to you, and I hope that you get better soon. This chart here shows our daily vaccination rates, and it has dropped a lot from the peak. But I take encouragement from how that line is tipping back up just a bit. We now have an average of 13,000 people a day getting their shot. So if you've been hesitating, look at this chart and know that you're not alone. A lot of people like you are making the right choice every day to get the vaccine. Do it to protect your family, especially if you have young children. Do it to protect everyone around you, because none of us is an island. We can call vaccination a personal choice, but our choices affect other people. And do it to save yourself. I do not want any Virginian to die, especially when it could have been prevented. More than half of our population is fully vaccinated. More than 70% of adults have had that first dose. Now, many parents are particularly concerned about their children going back to school in just a few weeks. We still don't have FDA authorization to vaccinate children younger than 12, although I am hopeful that this will come this fall, just in the next few weeks. And Dr. Fauci said he expects the FDA to give full approval to the Pfizer vaccine as early as this month. That's great news. Local school divisions are taking the lead, including mask wearing and mitigation measures in their schools. We expect them to follow the law. And the law that was passed earlier this year says that schools will do two things this fall. They'll offer in-person instruction 5 days a week, and they will follow CDC mitigation strategies. The CDC guidance is that people in schools need to be wearing masks. That law was passed by a strong bipartisan vote of the legislature, and I expect school divisions to follow it. If they choose not to follow it, they should have a frank discussion with their legal counsel. In closing, I just want to reiterate how important it is to get vaccinated. As I said, almost all of the hospitalizations and deaths that we are seeing now are among unvaccinated people. That means that for most adults, this is now a preventable disease. So please get vaccinated. Thank you for being with us, and I'll be glad to take questions.
Regarding this K-12 stuff, instead of relying on this interpretation of the law, why not just offer require it and issue a mandate versus, if this is your interpretation of the law, others could interpret differently and lead to a legal fight, as you referenced, potentially referring to their legal counsel. Why not just mandate instead of relying on this GA law?
I'm not sure I follow your logic in your question, Cam, but it is a law, as I just said, that was passed by our legislature in March of 2021 that said two things. It said, number one, that children will be in class learning 5 days a week, and it said that the schools would follow the CDC guidelines. I don't know that it can be any simpler than that. It's the law of the Commonwealth of Virginia, and I expect our school districts to follow the law.
Regarding the state employee mandate, for those who refuse to get the vaccine, and if they refuse the weekly testing, I guess, what sort of, is it an immediate firing? Is it mandated work from home? What are the steps for someone who doesn't want to follow the mandate?
Well, I think it's a good question, and I expect our employees of the Commonwealth of Virginia to follow the law, to follow the mandate. If they choose not to, if they choose not to get tested, then obviously we'll take the next measure. But that's something that I'll discuss with the employees.
On the phone. I'm going to read them. The first question is from Sarah Rankin with the Associated Press. She said, does your administration know about what % of these workers are currently vaccinated and what consequences will they face if they don't comply with testing requirements? Can you target them?
Sure. I'm not sure of the number of employees that have been vaccinated. Does anybody have any of those numbers? If we don't have them, we can get them to you. Grinley, this is Grinley Johnson, our Secretary of Administration. Welcome.
The rate for the employees is the same as for the state. It's about 72, 73% that have been vaccinated. We're trying to get better information on that, but right now the same as with the statewide.
Thanks, Grinley.
Yeah, can you say a little bit more about enforcement of schools who, many have already said that they're going to make mask wearing optional for everyone. You said they should have a discussion with their legal counsel.
Sure.
How will the state enforce this exactly?
Well, I just would leave it at that right now, Jackie, that it is the law of the Commonwealth of Virginia. And I would emphasize to our school districts that this piece of legislation was introduced by a Republican. It had bipartisan support. It's the senator from Henrico County that introduced it, and if they have any questions, talk to their delegates and senators who not only proposed this but passed it, not unanimously, but certainly with I think a bipartisan vote. I think in the Senate there were 3 no votes out of 40. I'm not sure the numbers in the House, but it's the law of the land, and we expect our school districts throughout the Commonwealth of Virginia to follow the law.
Are you ruling out a mandate for the general public once FDA approval is fully reached, full FDA approval? Some might see this as a step in that direction.
A mandate for
The general public.
for vaccinations.
In Virginia.
Jackie, the way I look at this, I'm in charge of 120,000 plus or minus a couple state employees, and that's who I have control over. I encourage businesses across the Commonwealth of Virginia to follow that lead, and we've already seen some of that, but I anticipate seeing more of it. So we'll lead by taking care of the employees that I have control or jurisdiction over, and then I expect others to follow that lead.
We're going to do the next question on the phone. If you could ask if you could limit it to 1 question. We got a lot of folks today. Bill Atkinson, with the Progress Index, are you on the line?
Yes, I am. Governor, thank you for taking our calls. As you know, Hopewell became the first public school system to go all in on year-round education. They started school last week. As of today, despite the requirements for masking inside all the buildings and the other indoor COVID protocols, there have been 17 positive cases reported among students and staff. Now, the majority of those are community transmission and not traced to the schools. Mm-hmm. My question is, how closely is your administration, your team, watching what is going on in Hopewell, and will you possibly be making any adjustments in requirements for the school children as we get closer to the rest of the schools opening this year?
Sure, I appreciate the question, and we are watching that very closely. I was actually just out in Hopewell at Hopewell High School about 2 weeks ago, and so we'll continue to follow the mitigation guidelines that we've outlined, the wearing of masks, number 1, washing our hands, and also encouraging all of those that are eligible, and as we know, those that are 12 and above are eligible to be vaccinated, so we'll certainly encourage that. But I think it's important for all of us to realize our children sacrificed this past year, as did their families, and we know that the safest place for them to be is in the schools, assuming that they follow the guidelines, which we anticipate they will. So we're going to do everything that we can to have our children in-person learning this fall and to make sure that we do that safely and responsibly.
Governor,
Yes.
why would we strongly recommend mask use right now and not go all in with the mask mandate for indoors, for example?
Yeah, Henry, thank you for the question. And as you know, we have strongly encouraged individuals when they're in public venues, especially where there are high transmission rates, to wear masks. That's why all of us, and I appreciate you all complying in here today. The discussion that we need to continue to have, and perhaps these are difficult discussions, is regarding vaccination. We know, Henry, that masks work. We know that distancing works. We know that washing our hands work. But the thing that we know really works, and it will put this pandemic behind us, is to get people vaccinated. So the discussion today, and as far as our mandates at the state level for our employees and what private businesses will do, should really be focused around vaccinations and certainly around masks, but I'm not going to focus on making that a mandate.
On the phone? So Jennifer, one of the questions wants to know how employees will get tested if they opt out of the vaccine, if they opt out of getting vaccinated, and then what will happen if they test positive?
Sure. I will answer the second part of that first. If they test positive, obviously they will need to stay home. They will need to quarantine. I believe the current is for 10 days, Dan. As far as where to go get tested, we've had a lot of discussions with our Secretary of Health and with Dr. Avula, our Commissioner of Health, Dr. Oliver. We will continue to do everything that we can to make sure that testing is readily available and accessible in the Commonwealth of Virginia. So the places that can go are the places that we've always been able to go, whether it be the pharmacy or the health department. And if one wants to call or go online to our website, we will help direct them to where they can go to get tested.
I think she's asking, like, how will they get tested? How will they get tested and show the results?
Uh-huh.
Like, is there a process for that?
Sure. Just like all of us, when we get a test, we get the results back, and then we will show proof of that to the employer.
Oh, yeah.
Thank you so much for taking our questions today. So we've seen disparities play out in the vaccine rollout by race, ethnicity, income level, and I was wondering if you could kind of speak to what those disparities currently look like within, state employees.
I'm not sure I quite understand your question, but do you understand the question?
I think I do. Thank you for that question. We don't have it broken down by employer status. What's happened overall, however, is that over the course of the vaccination campaign, we've improved a great deal on the equitable outreach and equitable vaccination of people by race and ethnicity. So at the beginning of the vaccination campaign, the ratio of say African Americans to whites who got vaccinated was around 0.3. It's now 0.9. And in all the other racial and ethnic categories, we're actually vaccinating those minority populations at a rate higher than we are the white population. I suspect that, just as Secretary Johnson mentioned with respect to the percent of state employees vaccinated, mirroring that of the state population, that would be true in terms of the racial and ethnic breakdown of vaccination.
Governor, how are you doing today?
Well, and yourself, Andre?
Governor, my colleagues and I have been covering so many town hall meetings, school board meetings, rallies, and there seems to be this increased view that folks will not comply with this mandate concerning these students going back to school. They are added. Do you have any plans to soften that blow, if you will, convince folks to calm the temperature? People seem to be very upset about this.
If I understand your question, they're upset about the mask or having to go back to school, or?
Young people wear a mask to school. They're talking about their personal rights. They have parents, their decision, and they're holding rallies all throughout the country.
Yeah, okay, Andre, a couple things I would say. I've been to a lot of the schools too, and we have our Secretary of Education and our Superintendent of Public Instruction here. They've been with me. The kids do great with masks, and even 3- and 4-year-olds in the early childhood learning. So I think if we let the children know and the families know that we're doing this to keep their children safe, to keep families safe, I don't see that it would be a big issue. The other thing that I would say is and I appreciate you listening and hearing people complain, the great majority of the legislators that represent them in the Senate and the House passed this law that I just referred to, and I have it here if you'd like to see it, to say that our children would be in school and that they would follow the CDC guidelines. The CDC guidelines, which we've tried to follow all along, say that children in school K through 12 should have masks on. So if they have complaints, which I understand, there are individuals out there who have complaints, I would take that up with the legislators who not only proposed but also voted and passed this piece of legislation. And again, it was intended, Andre, to keep our children safe, and that is so important. As you know, we've seen the numbers of individuals, number of children that have contracted the virus going up, and we got to do everything that we can to keep them safe, and so that's why this was done.
Question from the phone. David McGee with the Bristol Herald Courier is asking if you are considering any short-term mitigation measures.
Well, thank you for the question, and we look at the numbers every day, and I would just say that all options are on the table. As I've always said, our staff here, I encourage them to be flexible and innovative. That's what we've done with the main objective to keep Virginians safe. So there are a lot of options that we discuss and look at on a day-to-day basis, and we'll follow the numbers. We are hopeful that if people will wear masks, if people will get vaccinated, that these numbers of the Delta variant, numbers of COVID-19 cases will go down, the number of people in hospitals will go down, and the number of deaths will go down. So, but we're all in it together, so I encourage all of you to be part of the solution.
Thanks for taking our questions. Have you considered reaching out specifically to other large employers, private employers around Virginia to encourage them to have a vaccine mandate?
It's a great question, and yes, we have. We've had a lot of conversations. We obviously have our Secretary of Commerce and his staff, and we're in almost daily communication with businesses. We also communicate with the chamber. Our goal, and our economy is doing very well in Virginia despite COVID-19. There are some industries, especially the hospitality industry, that has struggled, but our goal is we're the #1 state in this country to do business, and we want to do everything that we can to get our businesses back up and running, to get patrons back into the businesses. So as a business owner, and I think a lot of other business owners do, to be part of that solution, we've got to encourage folks to get vaccinated. So whether it's vaccinations or whether it's requiring individuals that come into your place of business to show proof that they've been vaccinated or have a negative test, all of these things are options. And I would say overall that the business community has been on board and has been very cooperative with our initiatives.
Question from the phone.
Connor, sort of maybe just looking to hear a little more about applying for the religious exemption. What does that process look like, and how will you verify that it's a sincerely held religious exemption?
We will have someone to answer that question momentarily. Thank you, Grinley.
We are still working all of the bugs out, and we hope to have a policy out within the next 15 to 30 days prior to September 1. But there will be a form that everyone will fill out and have to sign to attest to whether they've had a vaccination or whether their religious affiliation or if it's ADA, whatever the circumstances will be, we will evaluate it, and there will be a form that they will sign to attest to the truth.
Thank you, Green.
Wait, I thought, so would there be a religious and medical exemption if the alternative is to get tested?
You can either get vaccinated or you can get tested.
So is there a religious or medical exemption?
For not
For
getting tested.
the vaccinations, for state employees?
There's no need for religious or medical exemption. You don't need to actually get tested. So what she's saying is you have to show proof of vaccination and do it a test tube, but there's no need to proactively apply for religious exemption because you can just get tested.
With it.
Sorry, that was a little.
Henry?
Okay, we'll do last question for Henry.
I was just wondering if you actually knew a percentage of state employees under your control who are vaccinated at this point, if you guys know those numbers at all.
And I think Grinley addressed that, Henry. It's about the same as the general population. So, and obviously the employees of Virginia are adults. So about 73% have had at least their first shot, and just over 60%, I think it's around 62 or 63% of adults are completely vaccinated. So thanks. I just wanted to close and offer some comments and perhaps an observation. And again, I thank you all so much for watching. I thank the press for being here. Our goal all along has really been to make sure that we give as accurate and up-to-date information as we can. But one of the things that I said, and as you know, along with being a doctor, I also served in the United States Army. I served during Desert Storm. And one of the things that I said when all this started is that we as Americans right now are fighting a biological war, and our enemy is the COVID-19 virus. And when I when I served in the United States Army, one of the things that was so reassuring to me as an American was that Americans were on board with our mission. They were behind everything that we were doing to really try to win this war. And I would just hope that Virginians and Americans would look at this as a war and want to win that war. We're the best country in this universe. We're the best state in the greatest country in the world. So let's all be proud of that and know that the way that we're going to win this war is to roll up our sleeve and get vaccinated. And that's the way we'll put this pandemic behind us. And then we can move on as a country and come out of this pandemic in even a stronger position. So for all of you that have been vaccinated, I say thank you on behalf of Virginia and on behalf of this country. For those of you that haven't, perhaps for any reason, you've just been hesitant, go out there and be part of the solution. Be proud to be a Virginian. Be proud to be an American, and let's work together and get this pandemic behind us. So thank you all. And Henry, I'll give you the last word. When do you want us to be here again? Whatever you ask for, we serve to please.
I might have some more questions tomorrow if we want to just
all right, a
circle
good
back.
deal. Thank you all, and stay safe. Thank you very much.